That's the Nick and Jacob day. I have not officially signed on to this. This is not canon. We have a vote.
It's there.
Okay. $1,000,
No.
$1,500, and we abduct Jim.
And you get to shoot him in the neck all you want.
$1,000, $700, and we abduct Jim.
There we go. From fabulous Las Vegas, Nevada, this is Pod Therapy. Real people, real problems, and real therapists. You can submit your questions anonymously at podtherapy.net or email us at podtherapyguys@gmail.com. Happy Pride Month, everybody.
Woo. Oh, yeah.
Yes, I realize it's July 8th. Yes, I realize Pride Month was June. But this is Pod Therapy, and if you're caught off guard by our lack of punctuality, then you don't know us,
You haven't been
and
listening.
that's on you. And now, broadcasting from the Churn, I'm Nick Tangeman. That's Dr. Jim Joman. That guy. It's time for some Pod Therapy.
We're still skipping him?
Yep.
It's fine. It's fine. So we also want to throw in there Happy Easter. You know, we want to just get Cinco de Mayo. Hope that was wonderful for everybody.
What
Yeah.
month does Easter happen in?
Ooh.
It changes, but it's usually like end of March.
April?
I think it's April. I feel like
It's
it's
usually
April.
It's usually April, but sometimes it can be the end of
Because
March.
isn't it like after spring break?
Wait, who was who
Listen,
who in
Lutherans
this room
are
was
very,
a Christian pastor?
Okay, that's
that-
fair. But Lutherans are very
Shouldn't you
strict
know
about
that
this
shit?
shit. I don't know. The non-denoms, we don't take it that seriously. I feel like you Lutherans are like very
You don't
sticklers.
take Easter seriously?
I mean, because of the money.
fuck?
It's a big money day.
The fuck? I repeat,
It's
the fuck?
it's just a
It is a
Hallmark
floating
holiday.
day. I mean, the calendar floats, man. It goes from A to B. I don't know what it is.
I don't care about any of what you just said, because what you said before was we don't take it that seriously.
What's sad is that I wasn't lying. It's about hiding eggs and chocolate for the children. Happy Pride Month, everybody.
I do like Cadbury eggs.
Cadbury cream eggs are bomb. Is
and,
that
and the
officially
little
British?
mini hard Cadbury eggs, those are also good.
With the hard shell?
Yeah.
Those aren't Cadbury.
I don't think I've ever had
Cadbury
those.
makes I think Cadbury makes
The ones
a
that are
version
like
of that
the
as
milky
well.
chocolate inside with the hard shell, the candy shell on the
It's
outside?
a candy shell.
Yeah.
That's what I'm thinking of. I don't know if
I mean,
it's a
yeah,
milky
they
chocolate or not.
come in a bag, right? Like the
Most things come in a
No,
bag.
they're just loose. You just
You gotta find them.
Excuse me, sir. Did you want the chocolates melting out of my hands?
they're just out in nature loose. You
Just
gotta
pour that in my, just drip it into my mouth, please.
Pick them right off the tree.
you gotta get them early in the morning out here in Vegas. If they sit out in the sun too long.
Well,
it's
if
no
you
good.
can't tell, it's another Pod Therapy After Dark. Our summer programming schedule involves us recording whenever we can, and the last few have been Pod Therapy After Dark. Our least popular merch next to Jim's Bat Mom.
No, we changed the name.
Next to Jim's chiropractor.
Chiruptra parents.
That one.
We don't want any legal issues with the
I
Ice
don't
Cream
want any
Social
problems.
podcast.
Any problems around here.
I gotta tell you,
we're-
Jim's Batmom t-shirts are flying off the racks.
Ah, I'm sure they are.
We've sold a lot of those.
Have you really? Are you-
Yeah.
All it takes is a little bit of a flare war, and people are like, well, I'm going to the mattresses. I'm behind them 110%.
Like, wait a minute. Like more than one?
Yeah.
Damn.
How many of those were to my mom, though?
That would be like she buys one of ours and two of theirs.
I would,
I just like the design. I wanted to get one for everybody.
if your mom would just, like,
If she sends me one for Christmas, I fucking am quitting the show. I'll tell you that right now. I'm
I
walking
would-
away from the show.
I would be
Done.
so insanely happy if your mom bought an ICS Jim's Batmom t-shirt.
Yeah. That would be awesome.
Yeah, I could see her wearing it. It's my birthday. Don't do that, Mom. But yeah, so go to podtherapybaitshop.com and get you a brand new Jim's chiropractor mom parent,
Chiruptra.
that thing, t-shirt. It's beautiful. Kate Keller made it, and it's super duper cute. You should check it out as we are
It is
floating
pretty
through.
good. And I did tell Kate,
Okay.
every time I look at that image, I literally start laughing out loud.
Oh, yeah? It's so
There's-
well done.
Oh,
Yeah,
God,
it's
there's
really well done.
something, There's something about the picture of little Jim
Yeah.
as a child
Yeah.
holding a cookie,
Did you notice the
staring
shirt?
affectionately. Yes.
Did you see the shirt she put
Yeah.
on me? Yeah,
Yeah.
it's the mental health awareness shirt.
Yeah.
Little kid me was these big dopey Harry Potter glasses, and like I'm wearing like the mental health shirt.
Yeah.
It's so funny. Like, and then my Bat Mom is like, yeah, there. Oh, he's showing us his
Oh,
picture now
It's just so good.
in his red.
I
with
mean,
the.
yeah.
I mean, it is a cool
It's
design.
good.
It's his design's
it's
okay.
good,
I'm fond of
you know,
Kate's. I like Kate's
but,
design better.
yeah.
It's adorable. It's got the bat
I'm not
upside
dissing Kate's-
down.
I'm not dissing Kate's design. Kate's
It's
design
got
is
the
great.
apron, but yeah, that other one's. Who made yours?
Michael Ellsworth.
Oh, that's right. He
Oh,
offered
okay.
us the NFT. Did you see that?
Did he? I didn't
Yes.
see that.
He goes, hey, Jacob hasn't officially purchased the NFT. It's up for bid. And I thought, all right, dude, name your price. Like,
Oh, I was
buy
wrong.
the fucking rights to Jacob's store.
I was wrong. I said on the Patreon section that our shirt was 30% off right now, and it's not.
Oh,
It is 35% off
Oh, Christ.
at heyscoops.com.
We're already losing money on our shirt.
I know. I can't drop the price anymore.
How do you
It's
drop it
like-
below zero? I don't know. All right, we'll pay you. Just come get it. PodTherapyBaitShop.com. And if you're not a Patreon of the show, you are missing a good time. You can hear about
It's a good
Jim's
time.
paintball traumatic experience this weekend. You can hear about the finer differences of beignets from New Orleans.
You can hear about the new Patreon level that's up and
Yes.
coming.
Yes.
There's a discussion.
Spending a day with Nick,
A Pod
Jacob,
Therapy Day.
Once I
and
consult
Jim.
with my liability attorneys, we will get to that.
Right.
So yeah, come check it out. Patreon.com/therapy for all the bonus material that you can catch before the show. And of course, it's the unedited version of the show. Every once in a while, we have to edit out most of what Jacob says because it's just profanity or it's like somehow violating the Geneva Convention. So, you know, if you want to hear the real take, oh, he needs to start using that. He can start bleeping himself out.
Hey, Jim, did you hear what I did to the other day?
I will
I took and then
menorah. Just gonna start throwing out
that is one of my
random
favorite late night bits is unnecessary censor beeps.
Oh yeah. Oh
It's
yeah.
like NFL press conferences and things that it just put in censor beeps. And it's great.
I love
That's
that
funny.
bit. Unnecessary censorship. All right, we should probably get some questions here. This first one is called, is it normal to be by yourself? Hey guys, this question might be misleading. Ever since I was a small child, I had trouble socializing with others and talking in general. That has led me to miss out on some experiences that people had during their childhood and teenage years. I'm now 21, and while hopefully still having a long life ahead, feel very sad because that has affected my ability to make connections, respond to simple questions, and because of that, I have yet to be in a relationship. Even when I force myself to go out and make connections, I always feel very tired and extremely self-conscious. This hasn't gotten better, I feel. During the worst times in my life, I have attempted suicide because of it. Thankfully, it was a while ago. So what do? I love the podcast. It has been helping me a ton listening to you guys while at work. Cheers from Portugal.
Portugal.
Oh, that's
Very
right.
nice.
Yeah, very cool. I remember there was a note in there too that said, "Hey, English not my first language, so if I screw any of this up, just
You did great.
reach for the understanding." Yeah, no, totally came through clearly. Totally came through.
You did
Did they-
better than Jim.
Did they say how old they are now?
21.
Okay.
Currently 21.
Great.
And yeah, feeling like they missed out on a lot of things in childhood. That's affected them socially. They feel that's also kind of hampered their confidence in coming into relationships. This has hovered over their head to the point where in the past they've been suicidal. And yeah, and looking for that advice. This sounds familiar, doesn't it?
Yeah, because we had a very, very similar question in the last episode.
Yeah. That person was 40.
Yeah.
So much older. I mean, ancient of days compared to the spry 21-year-old. Yeah. Go ahead and tell us all what great shape
40
you're
is
in.
the new 30.
Go ahead.
Jim, go ahead and tell us what great shape
Tell us how
you're
much
in.
you can bench.
Oh,
Nick.
yeah,
Go
wait a
ahead.
minute, what?
Oh yeah, no. Go to
you wanna
patreon.com/therapy.
talk? Jim's got
You got
stories.
really
Jim's
defensive
got
last
stories.
time. The writer was like, "I'm 40 and I don't feel good about myself," and you were like, "I feel amazing." It's very aggressive. That's all I'm saying.
Okay, let's
Let's
start
talk
with
about this person.
Okay, let's get the suicide thing out of the way first.
Yes,
I'm glad that didn't work.
absolutely.
I'm glad you're still here with us. That is awesome.
Yeah.
So, yeah, I'm glad we're at that point. If for any reason that does resurface, definitely reach out, get help right away. Call the suicide hotline. I'm not sure what that is in Portugal, but I'm sure they've got something out
Your
there.
emergency services.
Yes,
Call the equivalent of 911.
exactly.
I believe it's called Nueve Uno. I'm international.
That's Spanish.
Oh, they don't
But
speak
good try.
Spanish in Portugal?
No,
They speak Portuguese.
Oh.
Jackass.
Oh, I fucked up. Yeah, that checks out. That checks
It's
out.
named after the country.
It is. Yeah. Yeah, that
It's
checks
super
out.
simple.
I mean, in my defense,
Go
most
on.
places
Go
not
on.
called Spain speak Spanish. I mean, come on. But yeah. Yeah.
You want to sit? You want to sit the
I'm
rest
gonna
of this
sit.
one
I'm gonna
out?
sit the next couple of plays out. think we're just gonna let that one go.
about-
I can hear Manu typing
about what
already.
you did.
I can hear it. Manu, leave me alone.
But no, this is very similar to the question we had last week, and I feel like a lot of our feedback I think would be the same.
Gym related.
Yeah. I mean, it sounds like. I mean, at first when I read this, it almost kind of sounds like just kind of regular old, being introverted.
Sure,
to some
it does
extent.
sound like that. Yeah.
It doesn't sound to me at this point like this is anything that we need to pathologize,
Right.
or label with a diagnosis
Right.
or anything like that. I mean, the way that you describe forcing yourself to go out, making new connections, makes you feel tired and extremely self-conscious. I can relate to that.
Yeah.
That is 100% me.
Oh, it's
when
exhausting.
I go out.
Yeah.
I'm actually very introverted. I don't go out. I don't do a whole lot of things. And
Nope.
so Scoop Group, great.
Yeah.
The Scoop
Yeah,
Fest.
we literally, whenever you
I
go
s-
on Twitch,
was-
you don't even talk on the Twitch, like whenever
No.
we're watching Scoops.
No, I never talk on Twitch.
You
but
literally text
I'm
Jacob
thinking
during the show instead
Scoop-
of
here's
chatting.
a great example of the difference between Jim and I. I've been a Scoop for a long time. We go to Scoop Fest. Jim takes a picture of himself up in front with a whole bunch of people, and I am about 20 yards behind him in the background.
I need to
in
find
the
this
corner,
picture.
in the corner, sitting in the dark, and you just see my head just peeking out.
Oh, there's the other half of
I'm
Pod
on
Therapy
there.
and the guy who introduced me to this.
Yeah.
He's still here.
But I feel the same way. Like when I'm in crowds or I go out,
Right.
I'm getting a lot better.
Yeah.
But like when I was in high school, college, it was very uncomfortable for me. And it's just one of those things that you just kind of continue doing it.
Right.
But also the other thing that kind of helped me is realizing that as an introvert, people are, if I make a mistake or if I do something socially awkward, people aren't going to remember that anyway.
Right.
And it kind of helped me decrease my anxiety about that, realizing that like, okay, yeah, if I say something stupid, I say something stupid. It's
Right.
fine. No big deal, And it takes
You'll
a
get
lot
good
of
at
like, yeah,
I
exactly.
say stupid things all the time.
I'm still here.
Exactly.
I just got the Portugal thing wrong.
Jim got a podcast out of it. He just keeps failing upward.
Yeah.
I don't know how this
It's
works.
honestly my entire business model. It's fine.
No, I tell you, I mean, I am not introverted. I'm very just out there. I'm social. I'm all of these things. Going out and meeting new people is exhausting.
Mm,
Yeah.
I mean, whether you enjoy it or not.
yeah.
I'll just latch onto that one little part of your email there. Going out and doing that, it's tiring.
Yes.
You got to remember people's names. You have to have conversations, and those conversations are more difficult when you don't know the person.
Right.
And I mean that is completely normal.
Yeah, absolutely. Absolutely. And I actually echo that. I've noticed that at this point in my life too, that like it's just very draining. But like I was just talking to a patient about this, I think, probably last month. And the patient was explaining to me that they felt that they are an introvert and they are very to themselves. And this person was also saying the same thing because we were talking about, hey, get out there and date a little bit. And this patient was saying, I just feel like so self-conscious. Who's going to really, are they going to find me interesting? Because whenever I'm trying to engage with people, it's kind of artificial because I'm honestly just not always feeling that confident and feeling like I'm jiving with the person or whatever. And so I'm trying my best, and it probably doesn't feel very authentic. And then I get in my head and blah, blah, blah. And the person was saying, who's going to want to be with an introvert like me because I'm really shy. And I was
Plenty of
trying
people.
to, well, that's what I told
Yeah.
them. I was like, first off, extroverts. Like you could find a lot of couples where one of them's an introvert and one of them an extrovert. This happens a lot. And so
Yeah.
like even extroverts are like, yeah, no, you're cool. Like, don't worry. And it was funny because this person was telling me they're really attracted to extroverts because they like that person absorbs all the energy
Yeah.
and deflects it away from them. And they're like, this is great. You just go ahead and just do you. And I'll just kind of be near and I'm having a good time too. But I don't want the light on me. Like I feel more comfortable just kind of being right here. And like I was explaining to this person, like that you are being overly critical. You're being overly self-conscious, overly critical. And that's something a lot of humans do. Like we hyper scrutinize every little thing we do and we think that there's some kind of deficit. If in writer, you may be doing this where you have that highlight reel in your head and you're playing every single thing you've ever done wrong. One of the only smart things Nick has ever said, and I give you full credit
all right,
for this.
all right.
This
I'm
is
ready.
your moment,
I'm
okay?
ready.
Shine up that star. This is good. No, this one was profound. I think you had a bit where you said, try to remember the worst and most embarrassing moments of your best friend's life. And like, can you do that? unless they've told you them, you probably can't. Nobody can do that for you. Like all of your most embarrassing moments, nobody remembers them. Not even your closest friend would remember your most painful, most embarrassing moments of your life. You do, and you're haunted by them. And that taints your brain and your memory.
Not exactly what I said, but close enough.
I feel like I sweetened it up a little bit.
What I said
I'm sure yours sounded stupid.
I was talking I was talking about, you were sharing a really embarrassing story.
As I tend to do.
A very specific story. And I asked you how many of the people who were there, if we found them today, would remember any of that story.
Right. Oh, yeah. It was my 4th grade reading week.
Zero.
Yeah, zero.
Nobody is going to remember that because their focus is on them. They remember things that are meaningful to them, not to other
it doesn't
people.
even stand out.
Here's the other thing. If I were to give you something to try, it works for me. Give it a shot. I don't know if it's going to work for you or not, but a lot of times if we are nervous and we are forced to have a conversation with people, especially people we don't know, we get so focused on thinking, what am I going to say, that we stop listening.
Mm-hmm.
And if you're not listening, you can't have a meaningful conversation. So try to focus solely on just listening. Anytime you try to think about or catch yourself thinking about, what am I going to say next? Try to stop that thought and just focus on listen to what they have to say. Listen to their story. Find something interesting about it.
Right.
Because then when you find something interesting about it, then you can start asking questions.
Mm-hmm.
And if you ask them questions, then they become engaged. The conversation flows very easily.
Because you're already interested in that.
So just this past week, Laura's brother got married.
Oh, yeah. I saw the pictures.
So we went to his wedding.
You guys look great, by the way.
Oh, thank you.
Great pictures.
Thank you. Appreciate that. Me especially, though, right?
Yeah,
Laura looks okay.
Laura was a nice accessory, but clearly you were the bride.
Thank you. Thank you. I was hoping you would notice.
Yeah, it looks great and white.
But so we went to the rehearsal dinner, and so I'm like, I don't even know Laura's family that well, right? But now I'm in a social situation where I'm meeting Laura's brother's fiance's family and friends.
Oh, right. Yeah.
Okay?
Yeah.
And, I really pride myself on trying to be more social. So I struck up a conversation with these people that I don't know,
Mm-hmm.
And so we just started talking about stuff, and somehow snowboarding got brought up. So I was listening to him talk about snowboarding, and I was like, oh, this is kind of interesting. I've never done this before. And then it kind of, like, I started getting all these questions, like, okay, so if you were to compare that to, like, first-time snowboarder versus first-time skier, what's more difficult? What's the easiest to pick up? And so I start asking these questions, and then they get involved, because they're like, oh, that's a good question.
Right.
Here's my response. And then it just flows naturally.
Yeah.
Right?
And you're authentically interested.
Exactly.
You find something in there to be interested about.
Yeah.
Yeah, no, that's a great
tip.
tip.
Focus on listening. Don't focus on talking.
Yeah.
The talking will come naturally.
Yes. Whenever you just focus on a topic that you like. The other thing, Ryder, that I would hope that you've already done, and if you haven't, I'm going to nudge you in that direction. Obviously you've talked about in your short life, only 21 years old, that you've had some moments there where you say, I've attempted suicide. And, so clearly we take that very seriously, and we are very glad that you're still with us. And obviously, if that's something you've done in your life and something you feel you could drift back into that lane, then I would hope that you have contact with some kind of therapeutic support. And I'm sure Portugal has wonderful mental health professionals. And I would strongly encourage you to lean in that direction. Cognitive behavioral therapy, which you've heard us talk about on the show, is widely practiced. It's not an American specificity. It's something that's all over internationally in all of psychology, and that tradition would probably help you to challenge some of your perspectives on this. Because it sounds like you're looking at it similar to our last show, the 40-year-old, who was interpreting all of their absent experiences as inherent negatives that are conspicuous and weird to other people. And that's not it. And then like we get to this frame of reference where we question like every single thing that we say, and we think we sound weird, and we think that we're off-putting to others, and we think that we're awkward. And the truth is you're probably not. The truth is you're probably just interpreted as, a to yourself reserved kind of person, which is a great place to be. Abraham Lincoln said, I'd rather everybody in the room think I'm an idiot than I open my mouth and confirm it. I open my mouth and confirm it every fucking show. Everybody thinks Nick is so damn smart because he doesn't open his mouth and claim that Portugal speaks Spanish. But he was thinking it. But nobody knows.
You sure about that?
Confident.
I think that negated all
Confident.
the good advice that you just gave.
My point is go to therapy. I think
Yeah.
that you should, and I think if you could find somebody that practices CBT, that would specifically be advantageous to you.
Yep.
What language is spoken in Portugal, Jim?
Oh, that's the Portuguese. That's the Portuguese language. Also, but what language is spoken in Brazil?
Portuguese.
Fuck you both. When we come back, we're going to do a lightning round of a whole bunch of questions in one letter. You're listening to Pod Therapy.
Today's episode is brought to you by Smitty Scoop, Jake Schneider, Carolyn Albert, Kevin Chamberlain, and Polygon.
Did you really think we wouldn't know that?
I thought it was Spanish until Manu told us it was Portuguese. I thought it was Spanish.
Oh, no, I knew it was...
It's South America. I assume the whole thing speaks Spanish.
No.
What do they speak in Chile?
Chile, I don't know. I think that's...
You think it's Chilean? I'll bet you it's Spanish.
Would you like to sponsor the show? Become a therapy producer at patreon.com/therapy. Okay, our trivia theme in honor of our therapy producers this week is bird calls.
Oh, Christ.
I'm going to play you a bird call,
What?
and you have to tell me what kind of bird it is.
What, you think you're an audio guy now? What kind of tech are you walking in? Okay, you got your phone. Great. Okay, you're going to do that again. You know who could probably get this?
Ostrich. Final answer.
I'll bet you Ulrika could get this.
What is this bird? She might, actually.
I think she could. She's like an ornithologist or something like that.
Is it A, a cardinal, B, a robin, C, an oriole, or D, a kookaburra?
Ah, fuck you. You picked all
If you'd
birds that are
like
the
to
same
jo-
thing.
If you'd like to join the therapy producers
Should've
and make
been
sure
like an
possible, go to
eagle.
patreon.com/therapy and sign up.
You should. That would have been great if it's just you screaming in the bathtub. And we're all like, God damn, I don't know what that
Wait,
is.
is it the same thing for the next one?
Oh my god.
Is it the same thing for the next question?
Yeah, same
Yes,
exact.
same
I
thing.
want you to do. I
Same
want you to
theme.
do the bird call.
Yeah,
instead of
yeah, yeah.
playing.
That's
Oh my
how we
God.
should have done this
Okay.
game. Is
I'll
that you
try.
have
Yeah,
to
yeah.
mimic it.
I'll try.
All right, since they're all
Oriole.
equal, you're gonna go with Oriole.
Oriole.
I'm going to see oriole.
I'll go with Robin. That
Great.
feels right.
It was a cardinal.
Oh, I'll be damned.
Drat.
So
I feel like an idiot.
Yeah.
Oh, you didn't know that's what they sound like? You prejudiced bastard.
dumbasses.
Yeah, but what language do they speak?
That's true. I saw this great meme
Walt
on
says they speak
Instagram.
Spanish in Chile, by the way.
Oh, do they? Thank
Yeah.
you, Walt.
Oh, all right.
Okay, see?
Okay.
See? I was damn close. I was one country off. Is Portugal in South America?
You know, Chile and Brazil do not share a border.
That was my next question for him.
Oh. They're... Oh my God, they don't?
No.
Chile and Brazil don't?
No.
They're in South America.
A lot of countries are in South
No,
America.
there are 4 countries in South America, according to Risk. All of my geography knowledge is risk-based. All of it.
Next question.
That says it. That says it all.
All right, we got a little bit of a lightning round here. It says, hello, Pod Therapy Guys, new listener here, currently going through the backlog of episodes after hearing about the podcast on the Reddit AMA. Oh, good
You
for
should
you, friend.
stop.
You should definitely stop that right now. I have a few questions, though, of course, I understand that they might not get answered. They might not all get answered. But I figured I'd throw them out there anyway. Quick context about me. I'm a 26-year-old guy in California, recently moved back in with my parents shortly after getting a BA in psychology at UCSC. I have a history of depression and anxiety, in and out of therapy over the years since high school, and I'm currently having issues with brain fog, for lack of a better term, chronic sleep issues, and the potential of having ADHD. With these issues, I have recently, like late January, left my apartment leasing job due to not being able to keep up, and am unsure about my future. I don't believe I would be able to keep up in grad school or successfully manage myself if I move out with this brain fog problem. And it's caused me to essentially put my life on hold, so I can't figure it out. So, rapid fire, a couple of questions here. Could you guys talk about the symptoms of brain fog? That's the first one. And he has a little bit of a disclaimer in there. It says, the term brain fog seems to be the best term I've found to describe the feeling of constant confusion, concentration issues, forgetfulness, and working memory deficits that has put my life on hold.
Okay, there we go.
There it is. Yeah.
I was. That's what I was begging. I was
Yeah,
mentally
what is-
begging for, like, please define your give us your
Yes.
definition of brain
What
fog.
is brain fog to you? Because it could mean moisture coming off of the Bay Area. What does that mean? I would love to hear some professional thoughts on this symptom, what may be causing it, and what may be useful to do or try to manage or get rid of. Nick, any thoughts on brain fog?
Oh, we're not going to read all of them?
No, because they're rapid fire. They're
shit.
slightly unrelated questions, so I figure we're going to
define it.
abrupt
Yeah,
answers to each section.
So there's no real, as far as
It's not clinical.
clinical definition of brain fog, but your definition of it seems to be consistent with what I would
Interestingly,
describe it as.
I think of brain fog itself as a symptom because poor
Yes,
concentration, we have that clinical term,
Yeah.
like poor concentration, thought salad, flight of ideas, inability to concentrate. The writer mentioned being screened for ADHD. Seems like you're on the right track, writer. It seems like something you should probably do. And a lot of people with ADHD will sometimes describe a constellation of patterns like this. Now, it's interesting that you didn't notice it until the time in your life when you recently did, because it sounds like previously you didn't.
I did not take that email to mean that they were being
they never
screened
did.
for ADHD either.
Oh, okay. Hold on.
I took that to mean they thought they might have ADHD.
Oh, potential. Yeah, you're right. It says and
I
potentially
mean, they might be
having
being screened. I
ADHD.
don't know, but that's how I interpreted that.
Yeah, I mean, it is a symptom that is sometimes associated with ADHD. The inability to concentrate, flight of ideas. Poor concentration is a symptom associated with a lot of things. I mean, we'll even associate it with depression. So it tends to be something that shows up in a lot of diagnoses, though itself it is not its own diagnosis. I will point out, though, there have been a lot more cases of whatever we're calling this brain fog concept, slow cognition, sloppy thinking, inability to focus, poor rationality, poor judgment, since COVID. And we're seeing like a really weird preponderance. And I don't know that I haven't seen any studies yet that have nailed it, but there's been this interesting correlation between people who have had not even a specific strain of COVID and then developing this long-term brain fog thing for months and months.
Well,
So,
are you relating this to having COVID or just it being during the COVID
having
times?
COVID.
Oh, okay.
Yeah. So I haven't seen a slam dunk study about it. I'm not saying that it's necessarily linked, but there seems to be an interesting set of data that says there's a lot of folks that had COVID and then afterward describe themselves as having this brain fog.
Because anecdotally, to me, I would say just during the time of COVID,
Right,
everyone's
yeah.
lives
Slowed
drastically
down.
changing. Well,
Yeah.
not even slowing down. I mean, like some people's lives have, a lot of people's lives have just drastically changed. And-
Right.
And, along with those drastic changes, again, this is just me speaking anecdotally.
Right.
That seems like makes sense.
I would think so. So yeah, but there's some folks that like it's affecting their ability to work, which
Sure.
is actually going to be the next big disability crisis of America. Is if they ever do prove that there's a correlation or cause between COVID and then some kind of long-term cognitive delay or something like that, and it's enough to cause disability, there's going to be a ton of claims. So that would be interesting. The writer then says, when should you accept a doctor or psychiatrist's input versus self-advocating? And he gives us a little bit of a story. He says, in the last year, I've been in and out of a few doctors' offices, virtually of course, and it's hard to tell if I should be accepting a doctor's input or self-advocating and pushing for a deeper evaluation. A few examples. After 7+ months of a CPAP without much cognitive sleep quality improvements, my sleep doctor keeps telling me that my sleep quality issues are likely just due to depression or anxiety. At what point should I stop looking into this as a sleep issue? I recently had a video visit with a therapist to try to work through these issues, but I was told by the therapist in that intro session that I should wait until I manage my symptoms with a psychiatrist before going into therapy, as I would be able to get more out of therapy that way. My psychiatrist seems to be more interested in simply prescribing medications, and then they mention atomoxetine and Adderall, rather than go through and evaluate whether or not I have ADHD in the first place. When I was recently prescribed Adderall, I asked a psychiatrist if that means I've been officially diagnosed with ADHD, and he told me, well, to be honest, I don't know you very well, but I had to give you the diagnosis to give you the prescription. At what point should I push back and require some kind of evaluation versus just accept it and try the different medications? So far, the medication doesn't seem to be helping that much, but it's unclear to me whether or not it's the wrong dose, the wrong stimulant, or if I even have ADHD in the first place.
Okay, so rapid fire response to that. A couple things. First, I always look at the relationship between you and medical professionals or clinical professionals as a collaborative relationship, not necessarily one dictating to the other, and not necessarily you ignoring doctor's orders or your
Right.
therapist's orders, but instead working together. So your prescriber, your therapist, your medical doctor are going to make recommendations. You are going to help inform those recommendations.
Yes.
You provide the data, they interpret the data and make a treatment plan.
Right.
Okay. So you collaborate, you work together on all that. I mean, from what you've described, it doesn't actually sound like that odd of a situation as far as the way that they're approaching ADHD, because sometimes they will do that where they start treating it to really help in diagnosing it. So when they treat the ADHD with a medication, if you start responding well to that, then that's a pretty good indication that the diagnosis is correct. If you're not responding very well to it, then that would be an indicator that it is not ADHD. So it doesn't really sound that far-fetched that that's what's going on.
Because I mean that's how they're going to ascertain, like putting you on the medication if the medication helps.
Yeah. And it's also
Right.
very common. It's very common for a therapist, if you're dealing with ADHD, that's one of the ways that they are going to treat ADHD is with medication.
Right.
You can't really treat it in talk therapy without medication. You kind of have to have that medical balance in place first to address it.
Which
That's
may be what the
exactly it.
therapist is suggesting.
That's
with
what
that.
I suspect.
Yeah.
Yeah, that was exactly what I was thinking. So absolutely, I think Nick just nailed it. But basically, I've done
Two
the
for
same,
two.
2 for 2. I've done the same thing. So you'll have a patient come in. They appear to have symptoms of ADHD. Most of their complaints seem to be geared in that direction. So you look at that and think, okay, there's not a ton that I can do off the cuff because they're saying, yeah, man, I'm here because I have poor concentration. I'm here because I'm tangential. I'm here because I have poor focus. I'm here because I'm getting behind in life. I'm here because I can't trust my own judgment. I'm here because I'm impulsive and I'm irrational. Help me. And as a therapist, when you start sizing that up, you go, my working hypothesis is probably ADHD. But I can't change that right away. I can help you manage it if you choose to manage it without medication. I can choose you to become, or I can coach you to become insightful about it. When there's a lot of ancillary work we can do, but the heavy lifting is the prescription.
Mm-hmm.
The heavy lifting is going to be an amphetamine, and basically we're going to kick you back to the psychiatrist. But it is frustrating because you go to the psychiatrist, you go, hey, expert therapist really took some time to get to know me. They said, go to the medication guy. I'm here for you, doc. What do you have for me? And the doctor goes, all right, I'll give you some medicine. You go, oh, shoot. Okay, wow. So that means I have it, right? And they'll go, I don't know. I'm just giving you the meds. We're going to see how this works. And that can be really off-putting.
Yeah.
And if you go back in our back catalog, as you said you are, you'll find that we talk a lot about how diagnosis is not what you think it is. A lot of times people think, you're going to come in, we're going to sit down, we're going to do this really deep analysis, and then we're going to come to you and say, officially, this is your truth forever and ever, amen. And that's really not how we see it.
It's not a blood test.
It's not that. Yeah, we're guessing, we're throwing things out. These are working hypotheses. We're really more focused on the solutions than the problem. And I get it, though, because a lot of times you're like, it's this, especially with ADHD, it is such a big thing right now, and it's so big in a person's life that knowing that you officially have it, it can be, I think, validating. It can give you a lot of peace. A lot of writers have told us that in the past. But it's fickle because, yes, there are true assessments to try to nail down whether something's ADHD. First off, your psychiatrist's not going to do it. I think at most they're going to do the short form of it. The only people that I know that will even do it are going to be psychologists. Clinical psychologists will do a psychometric exam. And I still don't even think they're going to give you a hard diagnosis.
Right.
I think they're going to give you your scores and then say, I recommend you go to a psychiatrist and try out at their discretion certain medications that are known to assist with these symptoms.
And I don't think it matters to you.
Right.
I don't think it matters to you if you're diagnosed with this or not diagnosed with it. What
Right.
matters to you are the symptoms that are affecting your life.
Yes.
And that's
Yes.
what you want to deal with. And I would suggest
Solve
just
it.
focus on dealing with those symptoms.
Yeah.
And don't worry so much about self-advocating versus listening to a medical professional. And by the way, I would listen to the medical professionals.
Yeah, as a general
Right.
default. But I know what the person's saying there.
I do.
because
I get it.
The ADHD
Because it can
crowd,
be frustrating.
Well,
it
it
can be
is
super frustrating.
And a lot of the ADHD folks will say, I'm tired of not being listened to.
Yeah.
Like I'm coming to you with, in chronic pain will say this too. They'll say, I'm sick and tired of coming to people for help, and then I'm not listened to, and then you throw out something else that's just a hypothesis, and I'm here for answers, not guesses. And it is frustrating, but that's also why we call medicine a practice. And it is kind of this effort of like trying to find the next like rung of the ladder for you to push you a little bit further.
Well, that's it. I mean, and correct me, please, but you're going to have to try out some different treatments.
Yes.
And there's going to be a combination of, drug treatment along with some therapist, some therapy and everything else. You're going to have to nudge this a little bit. You're going to have to work with these doctors and find the
Yeah.
right combination of these things that works for you.
Right.
And I mean, that's just kind of where it is.
Even if hypothetically they know for a fact it's ADHD,
Okay.
you're still going to have to do that.
Yeah.
Because then you got to find the right medication. You
And
may
it's going to be
respond-
some work on your end.
Exactly.
Yeah.
You may respond one way to Adderall and a completely different way to
Right.
any
Ritalin,
or,
yeah.
or any other ADHD
Right.
medication. So
Right.
there's still going to be some trial and error.
Yeah. And so that's the thing, writer. I don't want you to be discouraged. Yes, I know it can seem hodgepodge. Don't be angry at the therapist. I've been in those shoes. I know that reality. And as a therapist, it depends on the therapist. Like for me, my practice is different because I don't use insurances. So that gives me a lot of discretion. So I can tell a patient, I can work with you whenever you're ready, and I'll work with you while you're trying to figure out the medicine thing. And I can be helpful for that because I see you a lot more often and a lot more in depth than the psychiatrist. So then I'll often like write my own notes on that, my own observations, and then I'll give you feedback and say, next time you talk to the doctor, here are the things I need you to identify for him. And I speak his language. So I'll give you the notes and then you can give it to him and he'll go, oh, let me switch to modafinil, or whatever. And like we trial and error this thing a little bit faster. But some therapists find themselves stuck because they're like, shoot, I really can't move the ball forward. You only have 8 sessions with your EAP. I know I could be way more helpful to you if we find the medication first, and then we can zoom in on anxiety and depression stuff, or we can see how much of that was ancillary to ADHD. So I'm sorry that the American medical system is broken. It is. But don't lose heart in the fact that you have a psychiatrist that's trying. Don't necessarily perceive that as disrespect. I do think that they're actually giving it their best shot, and it is a trial and error process. The good news is with ADHD medications, you find out rather quickly whether or not they're helpful. You don't have to be on them for 3 weeks. Yeah, like an SSRI for depression, you'll find out 3 or 4 weeks later whether it's working. With ADHD meds, they work. Like you will sense the difference in a week or so, and then you should be having feedback sessions with your psych where you can go back and go, hey, no, yes, and you could say, let me change the dose, let me change the script. Usually you can play with it until you figure it out. So good question on that one.
It's going to be some work on your end.
It is. Last rapid
And
fire question.
it's good work to do.
It is. Yeah, don't lose heart though. How would you recommend someone manage the expectations and pressures of parents while trying to manage mental health? And then he adds this little note. During this process, I've had some difficulty with family, specifically my father, who keeps pushing me to decide on a career or get a job or plan out my life despite my mental health challenges. With the issues I described earlier, I'm hesitant to move in any direction career-wise, as I don't feel like I would be able to keep up in an office setting like my last job, or further education like grad school or psychology or one of those accelerated coding boot camp programs like my brother did. While I know my dad means well, I'm not sure how to explain to him how debilitating this brain fog, sleep, and depression issues are to me, and how important it is to get them under control. So yeah, there's another piece of that too.
Ooh.
Life Coach Jacob.
The fact that you said your dad means well, the fact that you know your dad means well is wonderful.
Yes.
That's great. I'm really happy to hear that. It's your dad's job to make sure that your life is in order before he dies. That's biology.
A good point.
Yeah, and to shoot you if he feels that somebody else is coming straight at
Yeah.
you. He
And
should
not in the
shoot
hip.
you in the hip to wound you.
Not in the hip.
But he means well. He was trying his best, and he was scared. He was very scared.
I
'Cause he
feel
got
like we're
shot in the
conflating two
trach.
different things.
Patreon.com/therapy.
Yeah, check out the Patreon.
Your dad does mean well.
Yes.
Your dad loves you. Your dad wants the best for you. Your dad doesn't understand all of this.
Right.
Cool. Neither do you. Neither do I.
Right.
Jim certainly doesn't.
No.
Nick seems to have a pretty good handle on it.
Yeah. Spanish, Portuguese.
Yeah. Be patient.
Yeah.
Yeah.
Have conversations with him. Be patient with it. That shouldn't be your main focus. I hope it's not your main focus.
Yeah.
Yeah.
But I mean, your dad's main focus is to make sure that you are a self-sustaining, productive adult.
Yeah.
Yeah.
That's true.
And that's what he's going to keep on doing.
Yeah.
And that's what and by the way, that's what he's supposed to keep on doing.
I agree.
And that's what you absolutely want him to keep doing that.
Yeah. I agree with that.
Unless your symptoms are so significant that it's going to warrant you being, put on Social Security, disability.
Which is pretty rare.
Right. Unless it's that significant, you are going to have to understand that your goal isn't going to be to completely, fully address all of the mental health issues, and then you can go on to starting your career.
Right.
what you're going to have to do is you're going to have to get your mental health to a manageable position.
Yes.
And to which you can move forward with a career. So I'd say one thing is to just make sure that you're setting yourself up in the right mind frame for that.
Right.
We're talking about being able to coexist with mental health symptoms, not to eliminate mental health symptoms
Yes.
before going back to work. And if that's explained to your dad, maybe he's a little bit more understanding of kind of what your goal is. And you meet halfway. Yes, I know that this is something that I need to be doing. This is something I want to do as well. I just need to get to a point where I can coexist.
And that may be something that you can talk to with a family therapist about, you and your dad. You know, if your dad is willing to go with you, that might be a nice thing.
True.
And the two of you can kind of work out. And I don't know what other family members you have in the picture there, but maybe all of you can go if there's more family members that are involved as well. And that may be something a conversation led by a therapist where you can kind of express what those goals are going to be.
Yes.
And express what those milestones are going to be, where you can get once I reach this milestone, I feel like that is the point where I can go out and really start applying for jobs. I can start really looking for this. I can start looking for new living situations.
Right.
I can do all of these things and work out what those milestones are.
Yeah, and in fact, you've already got a really great asset writer. By the way, the writer's name is Alex. But like a really great asset you already have is the therapist who's already evaluated you a little bit and then said, I feel like you need to start steering into medicine first. Because I've had that happen. I've had patients who have shown up and said, listen, I'm here to kind of start something with you. I'm not sure if this is where, the direction I'm going to go in long term, but I kind of want to be evaluated. I kind of want an assessment. And then they've said, will you please then meet with my family and explain whatever it is that is going on from your perspective? Will you take questions? Will you have a family meeting? I have done that so many times.
That seems very valuable.
It is because I can come in as a clinician and say, listen, I'm not part of your family. I have no dog in this fight. I do not care.
Impartial.
If I think this person is completely making this up, I can say that in a gentle way, or I can say this is not a serious thing or whatever. I can size this up. But I think you have a therapist that would say to them, hey, I'm recommending medication. Like, I don't even know that I can approach this problem, and I'm an expert in psychology, and I'm a licensed clinician, and I feel this person needs medicine before they're even cognitively capable of doing good therapy work, let alone graduate work or coding skills. So I do think that you have an advocate built in right there that can educate the family about what you're going through. But I also still agree with Nick. And this is something where the National Alliance on Mental Illness, NAMI, is a huge advocate. This is where the growing ADHD community is a big advocate. We don't get to wait until we feel like we've got it all back. We don't get to wait until we feel like we're at 100%, and then we move on with our lives. A lot of times we have to start going forward when we're at 25%, when we're at 30%, when we're at 40%, and we have to start putting these pieces together and building our lives, because if we wait for it to all get better, we are missing out. And this is where your father's putting positive pressure on you in a sense, because nobody else in your life can give you that pressure. Your therapist wouldn't. If you told me, if I was your therapist and you said, I just don't feel comfortable going to coding camp right now, I would very gracefully say something very passive like, fair enough, absolutely. We'll revisit this and we'll kind of gauge your readiness as we go. But I don't want you to be scared to try new things. And that's about as hard as I would push.
Yeah.
Your dad is going to say, we need to talk about priorities, and I'm going to be that one voice in your life that can push you forward.
And we need to talk about where your life is going to go.
Right, and they're going to set a real stage.
Again, that's your dad's job.
Yeah.
It's not your therapist's job.
I see it as loving, but at the same time, I don't want you to feel fearful like you can't do it. You got to walk and chew gum. And for me, that going to grad school helped me with a lot of my problems, helped me with my crippling anxiety at the time. Like, I learned a lot from those textbooks. Instead of having to go to a therapist and ask these questions, I was reading therapist textbooks and going, I'm going to do that now. Like, it really helped. So that could be your cheat sheet of getting good answers, is go to grad school and maybe you'll find some of the stuff out for yourself as you go.
Progress, not perfection.
That's right.
Yeah.
The letter ends with apologies for the lengthiness of the message. Again, I completely understand if you cut any of this. We didn't. Thank you guys for what you do, and looking forward to hearing more of the podcast. Alex K.
Alex, we're on to you. I know that you know that we have a long backlog, so putting 3 questions into one.
Smart move.
Yeah, we see you. We see you, Alex.
But
See your moves.
We know what's going on.
All right, we're going to take a quick break. When we come back, we have a very interesting question about death in the family. You're listening to Pod Therapy.
I don't know if we got time. All right, thanks to our producers. This show is brought to you by Smitty Scoop, Jake Schneider, Carolyn Albert, Kevin Chamberlain, and Polygon. Our second bird call. I'll play it in a second. Here we go. Here we go. Second bird call. Are you ready?
Oh, got it. I got it.
What is the name of this bird? Is it a bald eagle, a falcon, a merlin, or a hawk? If you'd like to join the producers and make the show possible,
all four of them.
go to patreon.com/therapy and sign up. Again, that's patreon.com/therapy.
Jim believes it's a trick question.
Yeah, it's E. Harvey Birdman, attorney at law. That's clearly the answer. You're an idiot for even putting those other ones in there. I'm going hawk.
Falcon.
Wait, falcon was an option?
Wait.
Yes.
What? Name them again?
Bald eagle,
Uh-huh.
falcon, merlin, hawk.
Shit, I better stick with hawk.
Oh, man.
If I get it wrong now, I'm going to be pissed.
Because wait, I'm not sure the falcons are that loud.
That's a hawk.
That feels more hawkish.
It is a hawk.
Walt, do you have a guess? Walt thinks hawk.
All in on hawk.
Yeah. I'm swinging over to hawk. I'm going to be pissed if it's falcon.
Good for you.
Is it a hawk?
It's a hawk.
Yay!
All right.
Yeah, we've all heard that sound.
Yeah.
That terror scream.
I always thought it was an eagle.
Oh, really?
Yeah,
That sound?
I always thought that was an eagle.
I bet I know why. Did you ever watch the Colbert Report?
Yeah.
Oh, shit.
Because
it does
that
sound
is-
like that.
That is
Yep.
the thing that they would play when the
Whoa.
eagle
And
would come out.
they show a bald eagle.
Yeah.
But it's a hawk.
And I knew that it was not a
Oh.
bald eagle. That was the one thing that I knew it wasn't.
Yeah.
Oh,
I was positive it was
wow.
not a bald eagle.
Yep.
And then I was thinking about falcons. I've never heard a falcon do that kind of cry.
Yeah.
Oh, wow.
They kind of screech and do things like that, but I've never heard them do that because they're not like most falcons aren't that big.
Is there a falcon on here? No, I have an app,
You have a bird call app?
which I downloaded just for tonight's show. That's it. It's not on here.
All right.
Wow.
What a shitty app.
Man, I can't believe there is such a thing as that. Okay. So, because of limited time, I'm going to jump to a different question than the one that I
Shit,
previewed.
we're calling an audible.
We're calling audibles here. Night terrors and childhood trauma. Hey guys, I'm new to listening to your show and have been loving every bit of it. As I am new, I hope this hasn't been asked before, but I've dealt with night terrors for the last 10 years. It all started with some traumatic childhood and past relationship situations. I don't think it was.
Oh.
I'll
keep listening.
The last 10 years, it all started with some traumatic childhood and past relationship situations, and even though I've been seeking help and I'm on medications that help, they won't go away. Shoot, I was going to recommend the medications. Sounds like they already did it. I often wake up shaking or in tears and don't remember a thing. And sometimes I don't wake up at all. Interesting. It causes me to wake up in pain from clenching my fists, and my partner has trouble sleeping next to me at night because I wake him up and then he spends time worrying about me throughout the night. Although my medication and counseling have helped during the day, the night terrors, as I call them, will not let up. Any advice would be helpful so that my partner and I can get a good night's sleep. Thanks, guys. Joe, and pronouns are she and her.
So she doesn't. Wait.
So
she
Joe
does or doesn't remember them.
sometimes does not. Sometimes does not remember.
But sometimes
them.
does.
Yeah, wakes up.
Okay.
Doesn't remember them. Yeah, shaking in tears. Yeah. So I have seen night terrors in a variety of situations. I had them. My infant had them back. My boy who's 11 now. Whenever he was little, as an infant, he would have night terrors. And boy, it's intense. I mean, especially when it's a little kid, because they'll wake up. They're not really awake. They're in this like weird slip space between wake and dreaming, and they'll sit up in their crib and be screaming, and like you'll run in there as a parent, like, oh my God, it's something bite them or something. Like, what's going on? And like they'll be sitting there inconsolable, and you'll be trying to like look at them and touch them, and their eyes are like not focused on you, and they're just like looking off in the distance and just screaming, and you're like trying to soothe them, and then eventually they just snap out of it. And they just start looking around like they've come out of a dream, and they'll look at you, and they're just like their faces are wet. You know, they're still dealing with all the physical symptoms of fear.
I'm confused.
Yeah, so they're still panting. Like their physical body is still giving the sympathetic nervous system effect, but then they're just like looking around like, wait, what's happening? And so like I really empathize with Joe's partner, who is like holy shit, are you okay? What's going on? Because I remember being a parent and seeing this going on and being like, I am powerless to help you. Like, I cannot do anything. All I can do is protect you while you're doing this. And that was an infant in a crib. I can only imagine what this is like with an adult partner doing this. It's just got to be terrifying.
Is there any association with trauma with night terrors?
I don't know that I have seen that. I mean, now again, I wouldn't rule it out because
I mean, Jim did shoot his kid with a paintball gun.
I mean, things have happened.
Finally,
I've survived.
Too little, too late, if you ask me.
Yeah, eventually, 10 years later, I popped him in the hip with a paintball. Go to patreon.com/therapy, hear the entire tale. I would say this. There is an association between trauma and nightmares. And like, whenever the writer said that they're already medicated for it, my first thought, even whenever I read the headline of this, was, okay, we're probably going to talk about trazodone. Trazodone's like, or Seroquel is another one. And you'll see psychiatrists tend to prescribe these whenever somebody's dealing with nightmares. But night terrors... Now, again, the author didn't exactly go into depth a lot about what night terrors are, but if it's what I think a night terror is, it's not the same as having a nightmare. It's this visceral reaction like I was just describing to you guys, and the person afterwards like, what happened? Are you okay? What did I do? It's almost like sleepwalking, except in this very visceral kind of way.
Is this something that... I know nothing about this at all. Is this something that... either sleep aids or even, and I know this is a little homeopathic, but getting into like cannabis and that kind of thing, is this things that those things are used for? I'd be
interested in what a psychiatrist would say. I mean, I'm wondering what medicines you even prescribe for this. I would imagine, and this is, again, we do not offer medical advice on this show.
No.
It's educational intent and in purpose at all times. We do
I'm
not speculate.
not suggesting anything. I'm literally asking.
He can say whatever he wants.
Yeah.
I can't.
No, I'm telling you. I'm not suggesting anything.
Yeah.
I'm genuinely asking because I'm curious about it.
I'm curious because to me, I would imagine a psychiatrist would start with sleep aids. That I think that they would say, let me get you to full REM and let's just knock you out for the night, and then they won't have that. And the writer does say it's helping a little bit. What do you think, Nick?
I don't know.
And I'm guessing with your son that it's just something that
he grew out of it. Yeah, he eventually grew out of it. And it's interesting because when you look into it in lower age people that are dealing with this, infants and toddlers, it's very common. And so that's the first thing you read is like,
so
it's very common.
Is this something you just kind of have to break the cycle of?
At least in children, it has to do with brain development and the way that they're slipping in and out of REM and the way that their brain is like switching gears between awake and sleep. And it isn't that they're seeing something scary. It isn't necessarily a cognitive reaction. It's this kind of automated reaction.
So I guess this is one of those things that we need to figure out. Like when we talk about, we use the analogy of the difference between a software issue and a hardware issue.
Right.
Like when we're talking
this
about...
This is a firmware issue, in my opinion. Hold on. Let's start with asking you if you know what I'm talking about.
I have no idea what you're talking
Spanish.
about.
Yes. The Chileans
Argentina?
speak Chilenese. That's what you need to think about.
Okay.
All right. Name 2 countries that we have not said so far that are in South America. Let's just bring this to the front.
Paraguay. Fuck. Bolivia. Colombia.
Just 2 is fine.
Okay.
Yeah.
I proved my point. All right. Can we get back to the question?
Panama.
Oh, that's Central America.
Isn't Panama in South America? At the north end of South America?
Let's go to Walt.
I think
Oh,
that's
your brother shakes it off.
Walt says no.
Walt
north.
says, get a map, you dumbass.
Yeah.
Panama Canal. Fool.
Walt is better traveled in South America than I am.
They ain't trying to dig a Panama Canal through a continent. That's through the Central America thing. What are we talking about? Night terrors? It's a son of a bitch. So, writer, I don't know that there's a clean answer to it.
I know. I'm almost kind of thinking this is kind of going back to our example, maybe more of a hardware issue.
Yeah. So you're in the right treatment zone. I'll tell you that. Like talking to a psychiatrist, right place to be. I mean, I wonder if a sleep specialist could be helpful.
Do like a sleep study or something.
I would actually wonder what a neurologist would say. That's probably where I would probably direct you. So if you were my patient, you came and you told me everything you just did in that letter, the first thing I would tell you is I'm here to support you through this, and I'm here to help you process how difficult this must be on your relationship and to give you any support and coaching I can. I highly doubt that I have anything in my toolkit that's going to change this because, as you were saying, Nick, I don't see this as a software issue. I see it as either hardware. And so what we mean by those metaphors is there's your brain, that's the hardware. there is this layer of your brain that's like the invisible layer, that's like the mind, like who you are at an identity level. That's what I call firmware. And then there's the software, which are like the little ops and apps that you run, like fear and thought and romance and happiness and how you define things and what meaning is. Those are software things. Therapists tend to work on the software level. We help you redefine those things, work through problems like anxiousness and depression and trauma. Firmware stuff sometimes. Hardware stuff, we kick that to the psychiatrist and the neurologist. Those are the guys that have the toolkit that can actually help with that. Like, we can't talk to that. The brain's going to do what the brain's going to do. I would really be interested in what a neurologist would say versus a psychiatrist. Psychiatrists, and again, a little bit of education for the general audience. Psychiatrists are medical doctors that give you medicine. And it's a quick visit. You come in, you say, I'm scared. They say, I want to try on this low dose of anti-anxiety medicine. Tell me how it works in a couple of weeks. We'll follow up and work on it. That's pretty much it. A neurologist has different tools. They can do MRIs. They can come in and understand the deeper hardware of the infrastructure of the brain. They can also prescribe medicines, I think, a lot of the time. And they can also make a lot of, really good assessment referrals, too. And they would be the ones who I think would specialize in night terrors.
Yeah, that's kind of what I was thinking.
I don't think it'd be psychiatry.
Yeah.
Certainly wouldn't be therapy.
I agreed. I don't know what we could process, how you cope with that.
Yeah.
Yeah.
But
But
the two
otherwise,
experts
I
I'd
don't
refer you
think
to are either a neurologist or Jacob.
Right. It's either the neurologist or a life coach, I think.
Yeah, I think a life coach is
An uncertified life coach.
an uncertified life coach. Yeah.
Well, you want to go to the liquor store. Don't go to the liquor store. I'm kidding.
Unless you're buying it for Jacob. Then in
right.
which case, that's fine.
You can send it right in.
he will receive your donation gladly. But that's a tricky one.
I am curious about things like, I know marijuana is a weird one, but I'm curious if there are studies about that. I know this must be very frustrating for you.
It is.
So I'm really kind of throwing
It's
things
super
out
scary.
there and throwing kind of thoughts
Well,
out there.
we
just
saw
as I'm
something
thinking of them.
similar with Ambien. And so this was something
Yeah.
that Ambien started becoming this really interesting hot topic in medicine of like similar situations were being caused. Like there was legit like amniotic or
What turned
amnesic
several
fugue.
celebrities into racists.
Yes. What was that?
That
When did
was,
that happen?
There
who
were
was that?
what was it?
That
was it Roseanne Barr?
I think it was Roseanne Barr. She said she blamed it on the Ambien.
Yeah, there were a couple of others.
Yeah.
but there were
Blame it
people
on the
who like
Ambien.
there were people who like tweeted super racist things.
Yeah.
Did it
It's
on
like,
Ambien?
I'm on Ambien.
What are you gonna do?
Eh,
The Holocaust didn't happen.
and weirdly, nobody
Ambien.
really bought it.
Yeah.
They should add that to like the little disclaimers at the end of
Might
the
make you
Ambien
racist.
commercial.
Yeah. Might be.
Consult your physician or your rabbi if you've
Yeah.
said some kind of consult
If
the
you feel that you're
Anti-Defamation
becoming a
League.
racist, you may want to consult your physician about getting on Ambien.
But yeah, with the CBD or THC,
Right.
The thing is there's not going to be any hard science on that for quite a while.
Right.
Yeah, they're
You
still
know, and
only
that's-
getting the permits to start
Yeah.
studying it. And it again, I wonder if they're already trying medications and they're not. Listen, if you're not getting results with something like what did I say? The one that starts with
Ambien?
T? No,
Trazodone.
Trazodone. If you're not getting results with Trazodone, I
Yeah.
don't think CBD is gonna. The CBD is like shooting BBs at a tank, compared to
compared to
Trazodone
Trazodone.
or Seroquel. You give somebody Ketiapine, and if they're still waking up with night terrors, what? Ketiapine will put your ass in a coma, So I don't know, like, damn.
Is it the Michael Jackson stuff?
No, no. That was a different thing. Ketiapine is something it's an antipsychotic that they'll.
We don't recommend that you do the Michael Jackson
Don't
stuff.
do the Michael Jackson drugs. That will not help you. No, that would definitely kill you. So yeah, go to a neurologist. Or I would recommend that you talk to your psychiatrist and ask for a second opinion. But ask them if they think that you should go to a neurologist because you're probably going to need a referral anyway. So asking your primary care provider or your psychiatrist is probably a good stop.
Mhm.
Great question, though.
Yeah.
Yeah, very specific.
Yeah. How's that for a non-answer, Joe?
Yeah.
Yeah.
Hope you enjoyed
We
that
can
one.
dodge these bullets all day.
We're not the best in the biz for nothing.
All right, we are at the end of our show, gratefully. And we want to take a second to thank all the folks that make our show possible. Is this the first episode of July, or we already knocked that one out?
No, we already did that.
Okay, cool. So we've got some new ones. We're recording this as of Monday, June 28th. So if you have subscribed at any level at patreon.com/therapy and you don't hear your name today, that's probably just because we haven't gotten to you yet. Remember, you can always go to our Twitter at PodTherapyGuys, where we will always acknowledge any level of giving or change in level of giving immediately. just to celebrate you and make sure the world knows that you're with us and that therefore you're not allowed to criticize anything we say ever and ever. Amen.
Celebratory foghorn.
Because you're with us. Welcome to our new... Okay, wait. Let's rock, paper, scissors so you have to do the theropods. No, bullshit.
Nope.
Just because I let in, that's bullshit. It's rock, paper, scissors.
You literally just started it.
Are we going on 3? How do you do it? How do you do it in Iowa?
1, 2, 3, shoot.
That's how I do it too.
Okay.
Which
All right,
I feel
ready?
is proper. A lot of people jump the gun.
Are we
with 3.
doing best 2 out of 3 or just 1?
Ooh.
I think 1 and done.
Just one?
One
and done.
Fuck, I never win the first one. That's
One
the
and
hardest
done.
one. I'm a 3-game series kind of guy. All right,
All right.
whatever. All right, ready? 1, 2, 3, shoot.
Tied.
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 1, 2, 3, shoot.
That wins. Rock over scissors.
How did that happen? It's like 4 of the same one. All right, fine. We're fighting over who's going to do the theropods because we don't want to fuck up this name, but it's going to happen, and it's going to be me. All right. Welcome to our newest theropod.
Just say it in Spanish.
Dr. Scoop Little.
See, that wasn't so hard.
That wasn't so hard. Rolls right off the tongue. Ahem. And Ulrika. Nailed it.
Ulrika.
Fuck you. Then
Here's
why
the
didn't
thing.
you just do
Here's
it?
the thing. And I messaged her this because I want to know because she sent she sent the audio, like the clip, but that wasn't very helpful because I want to know the E at the
Ulrika.
end.
Ulrika.
Is it an A like apple?
No.
Or is it an A?
I think it's a schwa.
Oh my God, who the hell cares?
Ulrika cares.
Oh, no, you're rolling that R way too much.
Ulrika.
No.
I know that.
You know what that sounds like?
Who cares?
That was my favorite moment at ScoopFest 2018 is Paul just starts going off into like a Star Wars tangent and then
Oh,
the
the
whole
whole
audience
audience did it?
organically did that call and it was amazing. Also, I think you're rolling the R
But
too much.
I want to get it right. I'm trying. I'm really, honestly
The
trying.
difference is I don't want to,
I know
but
you don't.
I don't want to get yelled at. So, and mine is just pain
So-
aversion. That's
so
all I'm
have,
doing here.
I have internal
Yeah,
motivation.
yeah.
You have what's known as
External
motivation.
Yeah, I don't want to get my ass kicked. Well, also, welcome to our new pterodactyl, Lord Colin Stewart. Oh, another Lord.
No, it's
like
the same
me.
one.
No, I know, but
Oh.
now there's 2 of us. We have 2
Right.
Lords now at Pod Therapy.
Yeah.
It's good. We need more Lords. Classes to join up a little bit. And we want to thank our bosses, the Saccharin 16, the mysterious and shrouded Illuminati members of the fan club, the Theraproducers. Thank you, Smitty Scoop, Jake Schneider, Robert Brownie Jr. Mint, Kayla Lansbury, Ellie O'Dare, Judy Schneider, Nathan's Hot Dog Scoop, King of Student Loan Debt, Dr. Ben Dawn, Crazy Banana Scoop, Mason Miller, Scott Jameson, Carolyn Albert, Leon Kassab. Leon, get back to us with that legal advice. We're in the middle of a lawsuit with ICS. Kevin Chamberlain, Malaya, Richard Macy, Ezekiel Lawrence, Polygon, and Cindy Ash.
And if you'd like to hear this episode uncut and unedited
And why wouldn't you?
and enjoy our spontaneous side projects, go to patreon.com/therapy. And thank you for supporting mental health.
I'm going to do the whole thing in bird calls. That's all the time we got for this week's session. I want to thank our landlords, the Ice Cream Social Podcast, who are generous and benevolent and do not sue people. And thanks to those of you who contributed to our show today. We really appreciate it. Remember, pod therapy isn't something you should keep all to yourself. Share this episode with someone who needs it by opening the episode's description in your podcast app and copying and pasting the link we provided into your social media. Don't forget, you can find us at facebook.com/podtherapy, on Twitter at PodTherapyGuys, on Instagram at PodTherapyGuys, and at patreon.com/therapy.
Do you want to submit a question to the show? Ask anonymously at podtherapy.net or email us at podtherapyguys@gmail.com. I'm Nick Tangeman. Thanks, we'll see you for your appointment next week.
Attorney at law.
I feel like Adult Swim is far more likely to sue you than Ice Cream Social.
Get in line, Adult Swim.
Yeah, that's right. Leon can only process one cease and desist at a time. He'll get back.